name is Bhavanesh Makanjee, but everyone calls me Bhavi, friends and family anyway. I'm a cardiologist, specifically an interventional electrophysiologist, which means I'm a doctor who looks after patients with heart rhythm issues. And I just started my role in Humber a month ago. My role at Humber has been to join a vibrant group of cardiologists to improve the services that are available to patients that get treated at Humber. I've really been asked to join the strategic think tank of the arrhythmia physicians, led by Dr. Doug Ng and Dr. Irving Tiong jointly, under the leadership of Dr. Najaf Nadeem, who's the Chief of Cardiology, and Dr. Susan Torrey, the Chief of Medicine. It's an exciting time to be here and to develop innovative, thoughtful solutions that help fix hearts. That's an interesting question. And put simply, I was 5 years old when my mum, who was 33, would be in holidaying in India, dropped dead suddenly. She presumably had an arrhythmic death, and it was perhaps inevitable that my journey would lead me to seeking for answers. I was drawn to medicine, cardiology, and ultimately electrophysiology, where I deal with patients who are at risk of dying suddenly, families who've experienced the loss of a loved one from arrhythmic death. So I think she was my inspiration, and that remains the case as of today. Fixing hearts is simply groovy. There's a visceral satisfaction that comes from saving lives and making patients feel better. It's clearly delineated. You either have done it or you haven't, and you can't fool your patients with regard to this. I think the impact that you have on lives, visits to the ER, patients living with heart failure, chest discomfort, fainting, heart racing, is impactful for patients, their families, and the places that they work at. So yeah, that's my beat. Humber River has a reputation that speaks for itself. A leader in healthcare, the first North American fully digitized hospital. It's really incredible what this organization has done. The empathy for the diverse community it serves, the passion for patient care. I think the family of physicians, allied health workers, administration that are incredibly supportive has made my welcome into this organization very much appreciated. Speaking personally, I've known Dr. Zaki Ahmed for a few years now. It would be remiss of me not to mention that as a physician leader, he is exceptional, and that as a human being, he is warm, charismatic, and inspirational to those around him. So I very much look forward to my journey here. I've known some of the cardiologists for many years. They are friends and colleagues. I've known Dr. Doug Ng and Dr. Irving Tiong for well over a decade. Dr. Najaf Nadeem has a clear vision. He's an articulate leader who has bold, big plans for this department of cardiology. And to be part and parcel of that and to be welcomed in the team is a privilege and an honor.